Amlodipine versus Losartan. Which one has fewer side effects? What if the blood pressure medication that works beautifully for one person causes an annoying side effect in another? And what if one side effect is something you can actually see, while the other may be happening inside your body without you feeling anything? That's what makes the comparison between amlodipine and losartan so interesting. If you take amlodipine, have you noticed swelling around your ankles or lower legs? And if you take losartan, when was the last time your healthcare provider checked your potassium and kidney function? Because today, we're answering the question so many people ask: which one has fewer side effects, amlodipine or losartan? But here's the part many people don't realize. The answer may have less to do with which medication is better and more to do with which medication is better for you. Before we get into it, let's make this interesting. If you're taking amlodipine, type AMLO in the comments. If you're taking losartan, type LOSA. And if you're watching because someone you love takes one of them, type watching. Let's see how many people here are taking one of these medications. Now, let's start with why these two medications are actually very different. Amlodipine and losartan work differently. Amlodipine belongs to a group of medications called calcium channel blockers. Think of your blood vessels as roads carrying traffic throughout your body. When those blood vessels are relaxed and open, blood can move through more easily. But when the muscles in the vessel walls tighten, the pathway becomes narrower, increasing resistance and making it harder for blood to flow. Amlodipine helps relax those blood vessels by limiting calcium entry into certain muscle cells. In simple terms, it helps open up the road, allowing blood to move through with less resistance. Losartan takes a completely different approach. It belongs to a group called ARBs, or angiotensin II receptor blockers. Angiotensin II is a hormone that can signal blood vessels to tighten and also plays a role in the body's regulation of sodium and water. Losartan blocks the receptor where angiotensin II normally acts. So instead of allowing that signal to have its usual effect, losartan interferes with it, helping blood vessels remain more relaxed. Two medications, two different mechanisms, one goal: helping control high blood pressure. But now we get to the part that matters most, the side effect you can actually see. Let's imagine a woman named Grace. Grace is 67 and has been taking amlodipine to control her blood pressure. At first, everything seems fine. Her blood pressure improves, and she doesn't notice anything unusual. Then one evening, she takes off her socks and notices deep marks around her ankles. Her shoes also seem tighter than usual. A few days later, she notices that her lower legs look slightly puffy again. This is something worth discussing with a healthcare professional because ankle and lower leg swelling is a recognized side effect of amlodipine. It happens because of changes in blood vessel pressure and blood flow that can encourage fluid to move into surrounding tissues. For some people, the swelling is mild. For others, it can become uncomfortable or bothersome. But here's something important. Swelling does not automatically mean amlodipine is dangerous or wrong for you. Your healthcare provider may decide the medication is still appropriate, adjust your treatment, or investigate whether something else is contributing to the swelling. The important thing is not to diagnose yourself. If you notice new or worsening swelling, tell your healthcare provider. And if swelling is sudden or severe, especially if it's accompanied by shortness of breath or chest discomfort, seek medical attention promptly. Now here's where losartan gets interesting. Let's imagine another person. We'll call him Walter. Walter is 72 and takes losartan. Unlike Grace, Walter doesn't notice swollen ankles. He feels completely normal. But during routine follow-up testing, his healthcare provider notices that his potassium level has increased. Walter didn't feel it, and that's exactly why monitoring can matter. Losartan can increase potassium levels in some people and can affect kidney function in certain situations. This doesn't mean everyone taking losartan will develop these problems. They won't. But people with certain kidney conditions, those taking other medications that affect potassium, or people with other risk factors may need blood tests to monitor kidney function and potassium. That's an important difference between these medications. With amlodipine, A common issue can be something you notice and see: swelling. With losartan, certain changes may happen inside your body without obvious symptoms, and that's why feeling fine doesn't always tell you everything you need to know. If you're finding this comparison useful, take a moment to like this video and share it with someone who takes amlodipine or losartan. A parent, spouse, friend, or neighbor may be taking one of these medications without knowing what their healthcare provider is monitoring. And stay with me, because we're getting closer to the answer to the big question: which one actually has fewer side effects? What side effects can amlodipine cause? Amlodipine can cause ankle or lower leg swelling, but that's not the only possible side effect. Some people may experience headache, dizziness or lightheadedness, flushing or warmth, fatigue, swelling. These effects don't happen to everyone. And if you develop a new symptom after starting medication, don't automatically assume the medication caused it. But don't automatically dismiss it either. Your healthcare provider can look at when the symptoms started, your dose, your other medications, your health history, and other possible causes. Now let's look at losartan. Some people taking losartan may experience dizziness, fatigue, headache, and, as we've discussed, potassium and kidney function may need attention in certain people. There's also another interesting difference. Losartan belongs to the ARB family, and ARBs are generally less likely than ACE inhibitors to cause the persistent dry cough associated with ACE inhibitors. That's one reason an ARB may be considered for some people who don't tolerate an ACE inhibitor well. But remember, less likely to cause one particular side effect doesn't mean side effect free. Every medication has benefits and risks, so which one has fewer side effects? Now we're finally at the question: amlodipine or losartan, which one is safer? There isn't one universal winner. For one person, amlodipine may control blood pressure effectively with very few problems. For another, ankle swelling may become a major annoyance. For someone else, losartan may be easy to tolerate, but another person may need closer monitoring of potassium or kidney function. So instead of asking, which medication is better, ask, which medication is more appropriate for my health situation? That's a much better question. Your age matters. Your kidney function matters. Your potassium level matters. Your other medications matter. Your medical history matters. And your previous experiences with blood pressure medication matter too. That's why two people with similar blood pressure readings can end up taking completely different medications. And sometimes healthcare providers may use more than one medication because different drugs work through different pathways. But that decision should always be made with your healthcare provider. Never stop, switch, combine, or change prescription blood pressure medications on your own. 3 questions to ask your healthcare provider. If you're currently taking amlodipine or losartan, here's something practical you can do. At your next appointment, ask these 3 questions. Number 1. What side effects should I personally watch for? Not what your neighbor experienced. Not what someone on social media experienced. What should you be watching for based on your health history? Number 2. Do I need blood tests while taking this medication? And if the answer is yes, ask what those tests are checking. Number 3. Could any of my other medications or health conditions affect this treatment? These questions can turn you from someone who simply takes a pill every morning into someone who actually understands why that medication is part of your treatment plan. And remember, if your blood pressure has improved, don't assume you no longer need the medication. High blood pressure often produces no obvious symptoms. You can feel completely normal and still have blood pressure that's too high. If you're concerned about a side effect, speak with your healthcare provider rather than stopping the medication yourself. Your provider can decide whether the dose needs adjusting, whether another treatment would be appropriate, or whether the symptom may have another cause. The bottom line, amlodipine and losartan are both commonly used to manage high blood pressure, but they work differently. Amlodipine relaxes blood vessels through its effects on calcium channels. Losartan blocks the effects of angiotensin II. Amlodipine is particularly associated with ankle and lower leg swelling. Losartan can affect potassium levels and kidney function in some people, which is why monitoring may be important for certain patients. Both medications can also cause symptoms such as dizziness or fatigue in some people. So which one has fewer side effects? The answer depends on the person. The medication that's easy for your neighbor to tolerate may not be the best fit for you. Your health picture matters more than the name on the bottle. So don't just ask, which medication is better? Ask, why was this medication chosen for me? That one question could lead to a much more valuable conversation with your healthcare provider. And that's really the goal, not to make you afraid of your medication, not to tell you which prescription you should take, but to help you understand what you're taking, what your healthcare provider is monitoring, and what changes you should report. Because being informed doesn't mean challenging your doctor. It means becoming an active participant in your own healthcare. Now I want to hear from you. Are you currently taking amlodipine, losartan, or something else? Type amlo, losa, or other in the comments. And if you've experienced a side effect from your blood pressure medication, you can share your experience too. Your story might help someone realize they're not alone. If this video helped you understand something you didn't know before, hit the like button and share it with someone who takes blood pressure medication. And if you want more simple, easy-to-understand health information about blood pressure, heart health, medications, and healthy aging, subscribe to Healthy Living with Michael. Because the goal isn't just to live longer, it's to understand your health well enough to make informed decisions along the way. So remember, don't just ask, which medication is better? Ask, which medication is better for me? And why? That question could lead to a much more meaningful conversation about your health. Until next time, take care of yourself, take care of each other, and remember, your health is worth understanding. Close space.